Hello, hello, hello. Hi, how are you doing? Hi, Scott, how are you? Welcome, welcome. Good night to you too. Yes, hardworking nurse. Trying to be. How are you doing? How's your day so far? Okay, nice. Yeah, mine too. It's a little bit cold over here. It's snowing, so I'm stuck. Yeah. What's the weather like where you're at, Scott? How do I pin this? How do I pin this thing? So the number is 469-655 5152. All right, so I'm gonna pin my number just in case anybody wants to call and chit chat with me. Pin. All right, it's up and running. So that's my number if you want to come and chit chat. So Abe, thank you so much, Abe. Thank you for joining on the channel here. Hi, Flo, Oreo, welcome. Glenn Wagner, how are you guys doing? Shivam is asking, hey, Shivam, how are you doing? Your skin is really good and clear. What's your skin routine? Oh, Lord. Skin routine, just a regular bath. Wash with, I use the black soap. You know that black soap, I use it to wash my face and that's it. Then I put on my little moisturizer and, my little makeup, depending on how I'm feeling. Um, Glenn, is that for the live? What? What are you talking about, Glenn? Hi, everyone. Welcome to the channel. Thank you so much for tuning into the live. All right. Go ahead and double tap the screen. Okay. How are you guys doing and where you're from? Hi, Marvin. Welcome. Thank you so much for tuning in. Do you write code? People say my codes are very good. Oh, okay. That's nice, Flo Oreo. No. Light. Is it pink? Yes, it is pink. If you're talking about the top. Okay, Glenn. Thank you so much, Grace to me. Welcome. How is the weather in New York? Yeah, so I'm here as usual, charting. Scott says it's 60, but feels like 45 outside in Miami. Okay. Here, I think it is, I think it was 30 something or 20. What was it again? It was 20 something, but it was snowing and then it started raining. Okay. Gonna put you on a little bit of, how do I do this? Add as a moderate. Oh, no. Stupid. Put user in timeout. 24 hours. You can't go. Okay. All right, Grace to me, I'm gonna give you moderator mode just in case you're here. You can help me out here a bit. All right. Scott. Keep that snow by you. Yes, definitely will do. It's like 12 degrees outside in Missouri. Okay. I saw the news with Missouri getting a lot of snowstorm. Yes, Marvin, I was trying to see if I could, do a little bit of add some persons as moderator here. So Grace to me. No, not remove. Add standard moderator. Okay. So how are you doing, Marvin? All right, nice, Grace. Thank you so much. And where is Scott? You're gonna be one as well. Add as a moderator. Standard moderator. Okay. All right. Okay, nice. Yes, I am here, and as usual, I'm using okay, I'm using the time to do my notes and then just try to catch up with you guys as well. Hello, how are you guys doing? Thank you so much, Madeline. Thank you for stopping by. Yeah, so I wanted to kind of just touch on a topic because I have a lot of patients. Hey, Darren, how are you doing? Happy New Year to you. I have a lot of patients here. We're doing a lot of annual exam. So I was gonna touch on that for a bit as well. All right. Okay. Thank you so much for doing that. Yes, I was gonna touch on the annual exam because I have a lot of patients that I saw recently that we're doing annual exams for. So I was just gonna briefly touch on that, and then I know a lot of persons are probably not nurses here, but yeah. I have information regarding, somebody was asking about the DEA. So I was going to talk on that process as well. But if you have anything that you want to talk about, go ahead and, the number is pinned to the live here. So you can go ahead and call me and we can have a talk on the live here. If you have any questions or anything you want to share. Darren, how is your day going? Do you want to call in and chit chat for a little bit? Hi, Carolina Perez. Welcome. I'm doing good, Madeline. How are you doing? Yes, Carolina, I'm getting snow down this side. I think it has stopped and it's raining now, so outside is a little bit yucky. Thank you so much, Madeline, for saying that. Yeah. How is the weather where you're at and where you're from? Okay, thank you so much, Naya from India. Thank you so much for tuning in. Oh, okay, that's fine, Darren. That's fine. That's okay. Yeah. So, as I say, a lot of persons were, or a few persons were asking about some of the things for my my nurse practitioner. I wanted to just talk on the DEA, but I'm gonna talk about, the annual exam first, because a lot of us, it's the new year. Oh, you're in Knoxville, Tennessee. Okay. Well, stay warm, stay warm out there because it's really, really cold. So a lot of persons, we are seeing now and they're doing their annual exams, but some persons are not keeping up with their annual exams each year. So we're just going to talk about that because, that's one way for you to actually get certain testing done, be able to identify certain things from early. So we need to kind of start getting into the habit of, doing our annual exams, both for men and women. I know a lot of the men, them tend to, not wanting to go to the hospital or not wanting to go and see their primary care provider, and that's fine, but at least once a year, try and check in and get some testing done. Because when you talk about your prostate exam or your testing, you definitely need to get information on that and see where you're at, because nobody no want to start be peeing blood and having difficulty peeing later on. So all of those testings are very important. So let's just get into the habit of doing that. Yes, you can go ahead and call the number. If I call that number, what would happen? Oh, you'll just talk with me on the live here, Carolina. All right, that's all. So you can call and share your day with me and, the Think Nursing crew here. So feel free to dial the number, all right, if you want to. But yeah, so your annual exam is very, very important because, as I said, that's the one time you probably get a chance to do like a ton of tests, especially if you're using your insurance, you will be able to do a lot of testing. So for example, you have family history of certain things, depending on, what's going on with you, then you will definitely be able to get certain testing done just because it's preventative care. Hi Kadim, welcome, welcome. Thank you so much for tuning in. John Williams, welcome as well. Carolina, so like I can just talk to you because I'm a kid. Uh, Talk to your mom first before calling, Carolina. All right. I have blood test tomorrow and I'm scared. The Magic Five says that. You don't have to be scared, Magic Five. Just think about something nice. Think about, probably going to the beach or something, spending some time in Jamaica while that blood draw is going on. That's all I can tell you. But it's gonna be hopefully one poke and they'll be able to get a ton of tests during that time. All right. Kadim. Okay, okay. Hi, Blaze over time. What do you need help with? So regarding your annual exam, for my patients in the homes. Oh, yes, people, like up the live. Go ahead and like up the live, double tap on the screen. So for majority of the patients that I see, they're adults. I don't do pediatrics. And so when I go in and see them, most of the time thank you so much, Ima. Most of the time we're doing their annual exam and we do a lot of testing for them. So we go in, you get your blood test done. So in the blood test, we look at your cholesterol level, we look at your kidneys, how they're functioning, your hemoglobin, we look at your A1C to see if you're diabetic or you're near diabetic, and we also look at, your PSA, which is, for persons who are the men. We look at your prostate gland. Yeah, we look at that enzyme there to see what the numbers are. So that way, if you're scared of getting that little finger, nobody wants to do that little test, especially our men. They don't want to do certain testing. So at least, we are able to do, when we're able to do the blood test, we're able to see if there's any problems with your prostate, So before it reaches a stage where, your prostate gland has gotten that large, we'll be able to track your levels in your blood to see what's going on. Hi, John Williams. Yes, Reese Cup, your PSA. Vernon wigs. No, it's not wig, dear. It's all natural. This is what they call 4C. At least this is what I call 4C. All right. Hi, Pretty. Thank you so much for tuning in. All right. So those are some of the testing we do. We also go ahead and do, as I say, we do the renal function as well. We do your renal function as well just to make sure, everything is good with your kidney. And we also go ahead and do referrals for colonoscopy, or if you need your mammogram done, then we'll definitely get those going as well. Okay, Carolina Perry says, I have diabetes. Okay. How is your diabetes going? Are you managing it well? All right. In the house call visits, we do just like your regular. You see, when we come out to see the patients, we do their regular blood pressure. We look at their heart rate. We do physical examination. We also do, sometimes we do glucose check, to see what their numbers are. We also do urine test. And, okay. Yeah, so we do all of those testing. We also do your A1C testing. So for example, you're a diabetic and you're taking your medications at home. We definitely do every 3 months check on your A1C to look at that number to see if you are basically compliant and doing well with your glucose or your diabetes. So we check that every 3 months to make sure you are doing well with that. We also go ahead and get your weights. So some persons we definitely, have to, we don't do weights all the time. Sometimes I'll get, the patient's last weight, just like a verbal, but we'll try to see if we can get an actual weight, every now and again, especially for patients with CHF or heart failure, because you want to know whether or not, they're putting on weight, losing weight, um, and all. All right. And then during that time, we're also going in. Yes, this vlog is, basically nursing, but anybody that, is interested in nursing and, for regular layman out there who definitely need information, you can ask questions, and this information is for everybody. It's not necessarily only for nurses. So just in case, you're out there, you're diabetic, you're hypertensive, at least you'll have an idea of what to expect when you go into to see your doctor. As I said, this is something that we definitely want to encourage everybody to start doing, getting into the habit of, going to see a doctor, and don't be scared about it. Hi, Bernard. Thank you so much for tuning in. Anthony Coker says Americans know nothing about ackee and saltfish with 6 fried dumplings on the side. Anthony, you must come from Jamaica. Yeah, man, I something like my ackee and saltfish. Well, not 6 fried dumpling. Some days. Some days definitely do that. Yeah, especially the boiled dumpling. Okay. Kadim says I have diabetes too. Okay. So Magic 5 says I'm getting this blood test because over the past 6 months 6 months there has been blood in my urine twice, and I often have pain going. I'm a male and don't want some guy touching me up. Okay, well, that's fair enough. Go ahead and get your testing done, and hopefully everything is fine with your exam tomorrow, okay? But yeah, so that's what, when you're going to see your provider, they'll definitely do urine test, they'll do blood test, just to make sure that everything is good. Okay. So T. Bankhold says, if I may, why does the medical profession as a whole do not talk about sickle cell anemia, especially how to prevent? It is something that they discuss. Since I've been here in the state, I haven't seen much persons with sickle cell anemia. It's predominantly in my race, let's just say. But I don't really see a lot of persons here with sickle cell. The 1 and 2 that I do see, we go ahead and still treat them. But, we need to just make sure we're keeping these folks well hydrated, taking your medications and all. That's the most important thing, keeping warm and all. So, yeah. But it's not something that a lot of times you hear people talk about. And just trying to make sure that they're not pain-free, but comfortable. All right. Hi, Melton. How are you doing? Thank you so much for tuning in. Son of God. Yes, I'm from Jamaica. Where are you from? So bless, my head hurts so bad I can feel my heartbeat through my head, if that makes sense. Yes. Have you ever had migraines or anything before? Probably you need to just hydrate yourself. You can try Tylenol, Motrin and all. And this is not medical advice I'm giving or anything, but yeah, those are just general things you always start with as a layman. All right. So and then as a part of, when you go in to see the doctor, we will try to make sure we also go through your medications to see what medications you're on. Want to make sure you're not taking any expired medication, because a lot of persons that I see, they're taking medications from 2017 and it's 2025 right now. So I don't know how, they're doing it, but just make sure the medications you're taking are not expired. They're good medications, because that's how you're going to be able to benefit from the actual medication itself. All right. Yes, nobody. Yeah, just keep on seeing your provider regarding that. All right. Just continue seeing your provider and they will manage you appropriately on that. All right. And we also go ahead and make sure you're taking the right medication, the right dosage, because a lot of persons, especially some cultures, if one person's sick, they just assume that everybody has the same diagnosis, and whatever one person is taking, they continue with the same thing. No, it's not supposed to be like that. So not because you have cholesterol problem. Hey Marvin, how are you doing? Not because you have cholesterol problem, it doesn't mean that if another person in your household, has cholesterol issues as well, it doesn't mean that you are going to be taking the same dose. Everything is based on the evaluation of that patient, assessment, diagnosis. Yeah, so everything is based on each individual's needs. So do not be in the habit of taking other person's medication. All right. And as I say, as a part of the regular exam, you'll definitely get your regular head to toe assessment if you have any issues with your skin, or if you have lung problems, kidney problems, anything that is going on, that we definitely need to find somebody to, evaluate you. So for example, I could definitely need you to see a specialist for your kidneys. Then we'll do the referrals for you to see them. And then it's your responsibility to make sure you keep those, appointments and all. All right. Hello, everyone. Welcome, welcome, welcome. Just go ahead and double tap on the screen here. Thank you so much for tuning in. I'm reading your messages. All right. Some of you guys are really, really, a lot of things going on for you guys. So definitely follow up with your providers. Okay. Definitely follow up with your providers and explain to them everything else that you're explaining here on the live here with me. Okay, but feel free to ask me any other questions regarding certain things. Of course, I massage my hair when I'm washing it. Thank you so much, Nathaniel, for tuning in. All right. And as I said, we talk about the blood count. We also look at your cholesterol. We talk about, your kidneys and your liver function. And another thing is, a lot of us, when it comes on to, because especially if you're in the north, where it's really cold, definitely you want to get your levels checked. So a lot of us, we have like vitamin D deficiencies and all. So definitely we will go ahead and check all of those. All right. And we talk about your prostate exam that you definitely need. So talk with the doctors regarding that, or they can do the blood test. Okay. And as men and women, you still need to go and do your self-examination. So you need to do your testicular exams, and you need to do your self-breast examinations. All right. Thank you so much, Potato, for coming in. All right. And then depending on, like, for different screenings as well, for the skin, we definitely look at any moles or anything like that, and then do the referrals as well. So a lot of it is going to be, specialists that you'll be seeing to deal with certain things depending on what's going on. Mr. Splinter Kid, thank you so much for tuning in. All right. And then we also can do your EKGs. So for example, you're having your chest pain, you're having little shortness of breath, you're having, you have a family history of certain things going on. We definitely can get your chest x-ray, not your chest x-ray, your EKGs going as well. And sometimes we can encourage you to get a stress test or follow up with your cardiologist, depending on what is happening. So a lot of times, as I say, we definitely have you follow up, but for basic things like blood work, and your medications, we definitely will be able to do those. All right. And then when it comes on to mental health, it is something that a lot of us, struggle with, whether or not you're depressed, you're suicidal, you're having anxiety, we can always go ahead and start you out and start treating. And then, we always try to get a psychiatrist to see you as well. So if you need to be on medication because of something, that's going on, then definitely, we will refer you over to the psych team. All right. So, Shinobi, what do you suggest for not sleeping? More sleep, and then I'll recommend for you to follow up with your primary care. Okay. Okay, thank you, Joan Lowe, for tuning in, and Magic 5. Yes, there is a gap there. All right. How are you doing, Joan Lowe? Anything else? Okay. And then for a lot of persons, the Magic 5, just go ahead and speak. If you're under 18, speak with your relatives regarding that. I don't know why you'd be doing that exam, but anyway, speak with your relatives or whoever is taking it to get that exam done, and then from there you can decide. Okay. If you want to do that, then Elix, feel free to do that. But I don't know why you would be asking that question. Oh my word. Some people just come on this live and just ask anything it seems. But anyways, yeah, so it's very important for us to get our annual exams, as men and women in society. It's very important because that's how you're gonna stay out of hospital. That's how you're gonna stay out of the psych hospital, that's how you're gonna help with improving your overall health. All right, and it's always good to incorporate your diet, your exercise, as well as a part of everything that you're doing. So making sure that you're eating properly, and you are cutting down on your smoking, or you try to quit smoking, your alcohol consumption, you limit that as well, because in the end, the ultimate goal is to make sure that you are, very healthy. um, Pramod, hi, how are you? I'm doing fine. Thank you so much for tuning in. Where are you from, Pramod? All right. And then the other thing is, when it comes on to your annual exam, just try to make sure that it is something that you keep track of. So every year, so for example, if you do it, in January, you try to get the same exam done, the following January. So that way, if there is anything that you miss, at least, or not necessarily miss, but if there's anything that is developing throughout the year, at least your providers will be able to pick up on those the following year. All right. So once you're consistent with it, then they'll be able to identify and then prevent certain things. Okay. Remember to go ahead and like up the live, everyone. Thank you so much, Scott, for reminding the folks here. All right. Does anybody have any questions or anything that they want um to hold on. Marvin Lee. This is my Marvin, right? I think so. But if you have any questions, go ahead and okay. Nice, Marvin. Grenadiers. If you have any questions, I'm gonna have you if you have any questions, please go ahead and just, type them in the box here or in the comment section, and I'll try to answer them as much as I possibly can. Okay. All right. And then what else I was going to talk about today? Oh, somebody was asking regarding the application for the yeah, I'm trying to figure out how to do that. I'm going to talk about the DEA application because I know a lot of persons, or a few persons, had asked me a question regarding that. And the DEA is I was about to say dangerous drug, but it is the Drug Enforcement Administration application. So those persons who are nurse practitioners, doctors, dentists, pharmacists, anybody who basically handles certain controlled substance, then definitely you need this license to go ahead and handle those drugs. So one person, I remember I was talking in a video, and they were asking about some things regarding nursing. So I'm just going to touch on that application a little bit. All right. So this application, you definitely have to have a job first before you decide to go ahead and apply for it. You can't apply for it without having your license. You know, you need your state license to get that. And as I say, it is for nurses, dentists, nurse practitioners, or anybody who is handling those drugs. And then a lot of information they'll ask you. I think the application is probably like say about $888. $888, and then it is non-refundable. Then you have the application is very lengthy, but if you don't normally, like, you know, if you're not the kind of person that diverts any drug, or you've never been in any issues with your license, or, you know, with any drug related issues, then it should be a pretty straightforward application for you. It asks for like your regular just information regarding your background, you know, and you definitely need your social security. And as I say, you need information regarding your the practice wherever you'll be working to get where you'll be using that license. So you definitely need information from there. And then you do the application online, and the process takes about, I think they say about 4 weeks. But when I did mine, I got it back in probably like say about 2 weeks. So it wasn't that bad. Another thing is when I did the application, as I say, it's non-refundable. So just make sure you go through the application itself, and try not to have any errors or anything there, because once you pay $888, you're not getting that back, you know. So you're gonna have to just do over another application. But the good thing about it is that the lady who, or when I sent in mine, they were able to email me because there was some issues with, you know, the doctor that was doing my application with me. And so I went ahead and did over a different, there was something else that I needed to do, and I was able to just fix it there. So I didn't end up losing my $888. All right. So, okay. Nice, nice. Grace to me. She says she's in the process of applying for her first DEA, and the employer is giving me the runaround for who is going to pay the 800. Yeah, so some companies, they definitely will, you know, reimburse you for that $888. Some don't, you know, but yeah, I ended up paying for mine. I pay for everything for myself, you know, because my company ain't doing anything like that, you know. So um thank you so much, Marvin, for saying that. Great job you are doing here, Stacy. Continue to share. Thank you. No problem. Joshua says, would you recommend starting as a CNA or straight to a RN? Definitely go straight to a RN, unless you are scared of going into, you know, just stepping out there. But I don't see why you'd want to start as a CNA if you have the opportunity to, you know, just go in for the RN. I just think it would be a waste of time. I can understand some persons who are, you know, probably waiting for certain courses, you know, or trying in the process of getting certain things done, then this would be the way to go. But if you have everything ready, I wouldn't settle for the CNA. I would just go ahead and start the RN job or application. Grace to me says, sorry, this is a major hospital, so I'm expecting reimbursement at least. Okay, okay, nice. Yeah. At least they should be doing that. But sometimes what they'll have you do is, you know, as I say, yeah, they'll definitely reimburse you for that. When I asked my employer at the time, you know, she was like, oh no, you have to have everything. So that's just it. But yes, so you definitely have to have all of that information regarding, you know, the application. They do not accept Zelle, so don't expect you're gonna Zelle them any money. Yeah, they don't accept Zelle. It has to be the credit or debit card online for you to get that application paid for. All right, and then there are different forms that are available, so you definitely need to choose a form that is appropriate to you. So for example, you're a nurse practitioner, you need to get that form for the nurse practitioner. I think it was like 224 or something like that, the form was. You definitely need to fill out that form that is appropriate for the nurse practitioners. And then from there, you send off the application. Once it's approved, then they will definitely send you over that license. And what I would encourage persons to do is, well, for me, when I have any form of license, I tend to put them in my phone, so that way at least a month before, it gives me a reminder every year, so that way I don't miss anything. Just like my regular certifications. If I have PALS, my trauma certification, whatever it is, just go ahead and put it in your phone. Save it as like a birthday or something, so that way, you can have that reminder so nothing gets expired on you. Because, when things get expired, sometimes it's the hardest time of your life because it's difficult to get those renewed. So just try to keep abreast with your expiration dates and everything, so that way it doesn't reach that point where you miss a date or something. All right. Do we have anybody who wants to ask any question? Please go ahead and double tap on the live. And thank you so much if you're new here. Really appreciate you taking the time out. All right. So that was regarding the DEA application. Am I missing anything on that? Probably not. Marvin, do you have any questions for me? All right. So yeah, so I am basically just here charting up, charting. So Scott, did you work today? Or Grace, did you work today? So because it was snowing, today, I had a few patients that I had appointments for. So all of them I did like virtual visits today. And tomorrow is going to be virtual visit day as well, because I'm not going to be able to drive in that snow. Yeah, I'm not going to be able to drive in that snow. And a lot of places closed down because of the snow. So, I don't see why I'm going to be going outside. So how do you do? Hello, I quit. How are you doing? Where are you from? Grace to me, if you're here, how do you now that it is snowing in New York, how is it with your patients? Do you do only virtual visits at this time, or they recommend you still seeing doing house calls like in person? Because I know probably how many months out of the year it's snowing down that side. Okay, you're from Illinois. I quit. Okay, nice. Hi, Beja. Where are you from? Thank you so much for tuning in. If you're new here, double tap. My name is Matches with Winter. Winter Star. Okay. Clara is asking for a shout out. Okay, thank you so much. Just remember to go ahead and double tap. Are you about to start eating cornstarch? Oh my words, what these things when I read them, like, okay then. Hi Alice, how are you doing? And where are you from? Okay. All right. And then let's talk about what was it that somebody was asking me again? Let me see if I can find it. Someone was asking me about okay, you're not working. Oh, you're going to Jamaica tomorrow? Oh, I grudge you, girl. I grudge you. Where are you going? Which, not necessarily the actual location, but parish. I hope you have a wonderful trip, Grace to me. Bring back some food for both of us, Okay, you're from Texas, Alice. Nice. Okay, no problem, Angel. Jesus is coming soon. Yeah, I know. We just have to be ready. So Winter Storm says, I haven't seen my friend in so long. She works and she has a school at the same time. Okay, well, you need to get in touch with her. Get in touch with her, and so you guys can reconnect. Thank you so much, C. Chelsea, thank you so much. You're from California. How are things down there with the fire? I'm so sorry about everything that's going on down that side. It's a little bit scary. Hi, Naresh. Thank you so much for tuning in. Alice says in Texas, the gas stations are really big. Okay. I never really take note of it like that. I know Bucky's gas station is one that a lot of persons go crazy over. And the other day I was talking with somebody at work and I was saying that I've never been into a Bucky's, and they're like, "How can you be in Texas and you've never been to a Bucky's?" And I'm like, "I don't know. I just stop there, and get gas and just go." So I finally went in there and yeah, it was okay. It was okay. They have a lot of things there, but yeah, wasn't my cup of tea. It was just like a regular, gas station, but just bigger with more things. Winter Storm, you're from Boston. Okay, okay. I was at in Maine at one point. So I came into Boston a few times and that was nice. It was really nice down there, Winter Storm. Okay. What's the difference between American and Boston? I don't know. Tell me now, Winter Storm. You're so funny. Uh, Thank you so much, the amazing, energetic Joshua. Thank you for tuning in. How are you doing? And where are you from? All right. So another. Okay, no problem. Thank you so much for stopping by. I really do appreciate. Yeah, so if you haven't double tapped the screen as yet, go ahead and double tap on the screen there. All right. And then be a part of the channel, check out, there's a lot of information I share on the channel here. Oh, you're from West Virginia? Okay, thank you. I'm doing good. I'm doing good. Okay, no problem. So what area are you in, the amazing, energetic Joshua? Oh, Alice says she's going to China tomorrow and she's so excited. Okay, okay, nice. Just be safe, because I hear about that virus down that side. So just be safe. I know it's probably everywhere by now. A lot of us having flu-like symptoms and all. So I'm thinking it's here. So, but just be safe while you're out there and safe travels. Okay, Grace to me says, Mobe, we are still expected to attempt the visit. The only time we are able to reschedule the visit is if the patient says their home is not safe to come. Snow not shoveled, flooded street. Oh my word. Okay, okay. Well, just be careful because at one point when I was in Maine, I almost slipped on the ice. I think I did slip. Yeah, and it wasn't nice because I guess from country Jamaica and coming here, the first time going in so much snow, I never expected. I just I stepped out of the car and I thought it was okay to just walk, but the snow was there and I guess underneath had a lot of ice, and so I step out and slip. Yeah, man, it wasn't nice. So just be careful while you're out there. Well, happy birthday, Pauline Cunningham. Thank you so much for tuning in. Hello, hello, Inside Emotions, Naresh. All right, yesterday was your birthday. Okay, so we have a lot of January people here. Well, happy belated birthday, Inside Emotions. Thank you so much for tuning in. Okay, you're in West Virginia, Joshua. Okay, how is the weather down that side? So Alice is going to England after China. Okay. James Wilson says walks in snow. Okay, James, I see you. I hear you. Where are you from? All right. I've never been to Maine, but I've been out of the country 5 times. Okay, nice. Well, at least you've been out of the country, Joshua, because some persons in Maine, they've never left the state of Maine. And it was, it was very surprising for me. Yeah, they've never left the state of Maine. You have Portland all the way down there. And then what was close to Portland? I don't even know what was. I don't know. But yeah, some of them never reach at the border. Then don't even go down to Portland in Maine. So it's nice that you've left the country at least 5 times. It's not nice. Yeah, Scott. I don't like it. Don't like it at all. I remember one day I was driving on the ice and well, they had a blizzard, and so I was driving home, and I think I was the first person to go outside. Yeah, man, and was driving. At the time, I had a four-wheel drive, and I think it's still the best car to drive. And I tell you, I just feel the car just going left. It was a good thing I was the only person on the road, but I never panicked. I never panicked. I kind of just correct and take my little time until I get back on the road. But it's not like I was driving that fast because I never really know much about, um, driving on the ice. But I know I was just supposed to be careful. So I wasn't really going that fast, but I never really expected it. So you just have to be very, very careful out there. Okay, it's very cold over that side. Yeah, a lot of places very cold except California right now. Um, yeah, so just be careful out there. There's a lot of things going on. Hi, Serenity. How are you doing? Thank you so much for saying that. Biker dude, hello, hello, welcome. As you're here, remember to double tap and subscribe to the channel, okay? Yeah, I share nursing information and other information that you can probably relate to. All right, so just be a part of the team and welcome. All right. Mervin. Okay. Do we have any nurses here that are joining in? All right, you need to go, Mr. Let me put you. All right, so if you don't have anything good to say when you come on the live here, I really do appreciate everything that persons are doing. But if you don't really have anything much to say on the live here, some things we can keep to ourselves, I think. There's a time and place for everything. So thank you so much for stopping by, really do appreciate that. All right. Hi, Sadie. How are you doing? Thank you so much. Yes, Liv. Thank you. Thank you. All right. So let me talk to you regarding the graduate program. All right. So there was one person who had asked about the graduate program and how I got in as a Jamaican immigrant. Okay, Scott, no problem. I guess I'll just continue talking then. All right. So if you are interested in any of the graduate program, or if you're interested in going back to school in general, it's a number that you can call and share your day in the life if you want to. It's a number that you can dial now and just talk with me and share with the viewers anything that, you think you'll be able to give to my viewers that will impact them. If you just want to call in and ask how I'm doing, feel free to do so. Okay. All right. But if you are planning on going back to school or anything, it doesn't have to be a nursing program you're going to be doing. There is always, thank you. There is always information online that you can always, research. So depending on the school that you're going to, you can choose just about any school. And it can be online, it can be, in person. So depending on what you're looking for, always research and find out. But there are certain things that you definitely want to look up is whether or not, the program is recognized. So that is one thing you definitely want to look at, because you don't want it to be a case where you do a program and then if you're supposed to be doing, any form of licensing, you're not able to get licensing for it. So it doesn't make sense you do a program and then it's like you waste your money, so just make sure you're looking at that. Find out, if it's going to be a program where you definitely need to be in person, like say half of the time, or, or at least once a month, whatever it is. Because some programs, depending on what you're studying, will definitely say, okay, then we need you for in person, like clinical practice, or you're definitely just doing everything online. So like for my school, when I was doing my master's program, hi Def, thank you. When I was doing my master's program, I did it with a specific university. At the time, I was with one college, and that college wanted me to, come in at least it will be like roughly once a month, or no, 1 month out of the year, but it would be at different time periods. So like, every term you would go in for 1 week. So because I know I wasn't going to be staying in that state, I decided to switch over to a full online program. And so that worked out for me because doing traveling, I was still able to go ahead and still do my assignments regardless of what state I was in. So you don't want anything that is going to be holding you back um in terms of progressing with your program. All right, so Kadim, uh yes, so Marsha T says it must be accredited and credited in both areas too. Many schools are training are accredited, but the courses are not accredited, especially to transfer and or recognize. Thank you so much, Marsha, for saying that. Yeah. So just make sure we're researching because as I say, you don't want to be a case where you finish and then it never really work out in your favor. It's more like a waste of money for you. So make sure you're looking at that. Another thing you definitely want to look at is um how for online programs for me, I never really did an online program before. So if it's going to be something new for you, you definitely need to go on Google and just get some information regarding the process. How are you going to be turning in your assignments, things like that. Just go online and see different university and see how students are talking about, like, the process for getting their work in. All right. So, hi, Galata. Thank you so much. Well, good morning to you, but it's good evening for me because it's almost 7 o'clock here. But thank you so much for tuning in. All right. Before you do the application, though, you definitely need your transcript. You definitely need your transcript from your nursing school or the university you were going before, in terms of your undergrad program. And then you'll send that over. Most of the time, the university or the college you'll be going, they definitely want you to have the university mail that over to them. All right. I had used Parchment. I think it was Parchment. There's this website named Parchment, and you just sign up for it. And what they do is they'll send the information over. You can do the online or you can do mail. They do electronic and mail transcript. All right, so you can do that. And then you're definitely going to need letters of recommendation. All right. And then I did spoke with someone. Good night, Scott. Enjoy. Oh, no, 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 no. You're still here. Thank you. You definitely need at the time I spoke with someone regarding my the program, just so they can have an idea of why you want to, well, you're explaining to them why you want to, be pursuing that, and it kind of give you an idea as to, the breakdown of the different programs. So for example, for me, I started out with FNP program, and they'll tell you how the curriculum is. And then for some programs, depending on, if it's a program that has a lot of persons applying for it, then you might end up doing like a down payment for holding the spot. All right. So that was something that we discussed. And then they discuss with you, like, just the expectations for your courses and, how to use the library and all of those things. So they kind of give you a detail rundown as to what's expected in the program. All right, Marsha T says, be your own education advocate. Ask question, listen, seek mentors, advice, mentorships. All right, I advise many to put in volunteer hours, especially in the desired career field if available, but volunteer. That is so true. That is so true. And when you volunteer as well, by the end of the day, what will happen is that, especially if you're, so for example, some persons volunteer at the hospital and do certain things, depending on your work ethic and how you present yourself, after you finish, then you might just end up landing a job just because of, the persons you were working with. They know you, they know what you're about, and they will be more willing to work with you after you've graduated and all. So it's always nice to volunteer. And as she says, make sure you're asking questions. If you don't know anything, still go ahead and ask it. And even if you think that your questions are not that important, go ahead and ask it, because you might be surprised that probably 10 other persons thinking along the same line, and you might just be the bold person to go ahead and ask the one question that nobody wants to ask. So go ahead and ask question. And remember, it's always going to be online. It's going to be adult learning. It's adult learning. So don't feel as though anybody is going to come and baby spoon you. No, you have to go out there and get your information. Thank you so much, Amori. You have to go out there and get your information for your course. So it's not something where they're going to come and tell you that, okay, read this paragraph and, interpret it. No, you have to go out there and source your information for your program. So if you want to go and waste your time, then that's up to you. But, that's a lot of money you'll be wasting. So just go out there and make sure that whatever you're going to be doing, it is, it is something that you definitely want to do. And you're going to put your entire time, as much as you possibly can, into those programs. All right. And we already talked about, that. Another thing that with my program, I was encouraged to go ahead and like up the live, people. Please go ahead and like up the live. All right. And if you're checking out the page, remember to just subscribe as well in the meantime. All right. Then there's a section where, you definitely, as I say, you want to look at the cost, because there's so many different programs, online that are offering the same thing. And you also have a lot of persons, that are offering the same thing. And so you want to make sure that you are getting the best value. So you want to make sure you're getting the best education. At the end of the day, you don't want it to be a case where you go and do this program over here and you spend so much money doing the program, and then at the end of the day, as I say, it's not recognized, versus if you probably check out another location, you probably spend less and it works out a little bit better for you. So just make sure you're looking at the fees and everything. Some university, you have to pay like an application fee. You want to look at how much it's going to cost in terms of the credits. You also want to look at if it's a case where you're definitely going to be doing clinicals, whether or not, they'll be providing clinical sites, or if it's going to be a case where you're going to have to pay out of your pocket. Because for the nurse practitioner program, I know a lot of persons are spending a lot of money trying to get clinical sites going, their clinical experience going. So you definitely want to factor in all of that into, when it comes down to your financial responsibility. Marsha T says, it helps the resume, and it's not who you know at times, but who see you and know your willingness and drive. Dedication, commitment, focus on the goals ahead is essential to your education. That is so true. That is so true. All right. So dedication, commitment, and focus. Those are key. All right. And your willingness and drive. Those are very important, because, sometimes you can have a cute face. Yeah, man, you can have a cute face and your body look good, and your brain not there, and you're probably not even willing to work, so just make sure that, when you step out there, you go out there with an open mind. You go out there with an open mind, you ask questions, and just be inquisitive, just be hungry, to learn. Just go out there and be very hungry to learn, get the information that you need, and you just go, you understand? So that way, at the end of the day, when it comes on to you applying for whatever job you're going for, at least, you can be amongst the one or two persons that are there, that they'll be selecting. So just make sure that when you go out there, it is something that you definitely want, and you go out there with an open mind and just be willing to try or do as much as you possibly can to get your learning going, all right, or your education going. Holy Mindset TV says, where are you from? I'm from Jamaica. Have you been there? If not, you need to take a trip there, okay? Yes, Scott, learning is key and it's very important. Great advice, and you're a good mentor to others, enjoying your time to teach and advise those who are willing to listen. You are a superstar. Thank you so much, Marsha T. I really appreciate that. Galata, bless up to you too. And thank you so much, Chris, for saying that. You're beautiful and a great mentor. Thank you, thank you, thank you. All right. So that's one thing. Oh, another thing regarding financial responsibility or the requirements. Okay, yes, Holy mindset. Yeah, it would be nice to take a trip down there. It would be really nice to take a trip down there. All right. Um, so another thing you want to look at is, as I say, you look at, your financial responsibilities. So you look at how much you're going to be paying. There are different options that you can use in terms of getting your education. So depending on how you're, so for example, if you are single or if you are married, you don't have kids, and you feel as though you want to just work and then pay as you go with your program, then that's something that you can do. You can always do payment plan in everything that you're doing. So if you don't want to take student loan, that is the best route to go. So that way, by the time you're finished, even if it takes you 3 years to get your master's, you won't be in any debt with any student loan. Student loan here in the US, I think the rate is pretty low. Let's just say the rate is pretty low. So that is something else you can think of if you want to go that route. And you also have where you can apply for scholarship. All right. Okay, no problem. No problem, Marsha. Um, thank you so much for tuning in and for giving those advice tips. All right, Marsha T. All right. So I definitely encourage you to look up those as well, scholarship and assistant programs that they have. All right, see, my university at the time, they have scholarships that they have offering to different persons in different programs. So you can always go on the website of whatever school you're going and just look up whatever scholarship programs they have and see if you qualify for it. And that's another way for you to do your program. When I was doing my undergrad program, I was working, and that was in Jamaica. So I did the work and study program. So I was working while in college. So that is another option if you are, so for example, doing your undergrad program and you definitely need to make some money to help out with your school fees or just general fees or anything like that. That's another option you can think of. All right. And I know this is America. So, a lot of persons definitely can get jobs whether or not you're in school full time. There's always jobs available. And I know a lot of persons from my country, they usually come over here in the summertime and and do get jobs to kind of help out with paying their tuitions back home. So that is something, if you're here in the States, I think you should be able to do it, because as I said, there's so many jobs available at our fingertips. So make use of it and see if that works out for you. Remember, it's going to be only for probably, like, say, 3 years you're going to be doing it for, until you're able to get your bachelor's or your master's or whatever you're pursuing. All right. So what about travel nurse? You never did that before. Well, I was doing travel nursing. So when I moved to the state here, I did a long-term contract from Jamaica to Maine. And if you haven't heard that story is in one of my videos that I uploaded previously. But I was doing that, and then I was doing travel nursing, throughout. Then I did local contracts only. I did a full-time job a year ago. Yeah, in 2023, I did a full-time job. But most of my jobs were travel nursing and local contracts. I never really sit down one place too long. Was always on the go. Do you know Aunt Donna in Jamaica? Just asking Chandel. I know her. Well, not personally know her, but I've been on her live. She's doing some really good job. Chandel. Yeah, she's doing some really good job. So I want to give a shout out to her if you know her. But yeah, I've subscribed to her channel, watch her live, and yeah, I really do enjoy watching and seeing what she's doing. All right. Yes. But yeah, so when I was doing travel nursing was really nice. It was really nice for me. I really enjoyed it a lot. So yeah. Hi Glenn, thank you so much for tuning in. Really appreciate you taking the time out. All right, so that is it regarding your financial requirements regarding the program. Another thing, when you're doing your program, some depending on the university that you're going to, if it's a program that, so for example, you did your undergrad program at that same university, and you're going to be doing your master's program, there are certain courses that are transferable. If you're going to go to another university, then yes, Naresh. If you're gonna go to another, um, if you're gonna go to another university, then definitely, some courses are transferable, but not all the time they're able to transfer all the courses. So just keep in the back of your mind that if you're just going to be starting out, just check to see if, so for example, you're planning on doing your master's, is that something that you want to do at that same university to benefit from some of the courses that you've done. All right. And once you're able to do that, then, feel free to go ahead. Or if you just feel as though you're going to be making a lot of money and you don't want to go back to that university and you want to go to somewhere else, then that's another option. But, there are different programs that, will accept transfers in terms of credit from other universities. So just look out for that as well. Oh, yes, people, welcome to the live, and double tap on the screen for me. All right. And if you haven't subscribed and you're leaving, just remember, go on the channel and subscribe as well. All right. All right. So that's another thing you definitely want to look at. All right. And as I said, there are certain things so for example, when I was doing my master's program, there are certain programs or courses that, you have to do in order to get to the other one. So the prerequisite courses. So you have to get certain things done first. There's a specific order in which you have to do them. Can't be a case you're going to be doing, so for example, you have 5 courses. You can't be doing 5, then you jump on to number 2. You have to do them in a specific order. So you can look at that as well, the prerequisites that you definitely need for your program. And then when it comes on to application, there are certain deadlines that you still have to. Okay, no problem, Scott. You definitely would have to look at. All right, you have to look at your deadlines because remember, it's an online program. So a lot of times you might find yourself, getting a lot of emails. So you have to be checking your emails very frequently to make sure you're not missing out on any of your deadlines. Um, um you don't have to be missing any of your deadlines when it comes on to that. So make sure you're checking your emails and the school email, that is, for any updates on anything, because as I say, especially because it's not a case where you're able to sit down and talk with anybody. So even if you're going through a certain situation, not all the time you're going to be able to reach out to those persons in a timely manner for them to say, okay, then we'll give you the blight this time, or we'll give you have a valid excuse or something. We're going to just say, okay, then we will go ahead and process your application. Not all the time that will work out. Sometimes it does. Just be mindful that you don't want to be missing out any deadline. So mark those in your calendar to say, okay, then if you know that assignments are due on a Wednesday, put in your calendar to say that, a reminder for on Monday to say that your assignments are due on Wednesday. Or if you know that you need to do your application for your clinicals in August, put it from put it from July to say that the deadline is in August. So that way, you don't miss out anything. All right. And then another thing that you definitely can do when you're thinking about your program is, try to connect with persons on, different areas. So for example, you want to go in and do your bachelor's, try and find persons that you can be a resource, just get them to answer certain questions, here. hear how things are going, their experience with certain things. Just ask them a lot of questions so that way when you're going in, you have a better idea as to what to expect. Don't let it be a case where you have certain questions and you don't have anybody to reach out to. It's always good to have some form of support. And so connecting with persons, just like on the YouTube here, if you find somebody that has information that is valid, or valuable to you in your career or your education, just go ahead and subscribe to their channel. You don't have to be like, sitting down and typing all the time and chatting with those persons. But there's going to be information that they'll share on their channel that might benefit you. So it's always nice to just kind of check in with them every now and again. Get information on that. And while you're doing an online program, not all the time you'll be able to talk with, your colleagues in your class. You're not going to be able to talk with them most of the time. But it's nice whenever you do get their number for those one or two specific, classes that you'll be doing in groups. You just reach out and connect with them, see how things are going, because at that time, you'll be able to talk about certain things that are happening in the program. As I said, sometimes persons are going through a situation and they feel as though they're the only person that is going through that, when really and truly probably myself is having the same issue, another person. You can actually come together as a group or as a team and address the situation. You send over information to your faculty and get that situation resolved or attention being placed on it, because multiple persons are having the same challenge. So if you sit down and not knowing, and you don't have anybody to talk to, the problem is just going to be there all the time. You're not going to have the situation or the issue being resolved because nobody is attention to it. Hi, Frederica Felix. Thank you so much. Thank you so much. Okay, no problem. Thank you for sharing. Thank you for sharing it. I really do appreciate you taking the time out and doing that. All right. And that's about it on like networking. And then another thing is, if, so for example, you're going to be doing not an online program, but you're going to be doing like, an in-person program. Try to find out, if you can actually go over to the school and just kind of do a walkthrough of, the facility or the university, the campus, to see if it is something that you think will be safe for you. So you want to look at all of those when you're doing the in-person classes. Find out if it's something that is, gonna be best for you, or if you need to probably look at another company, or not company, but another university. All right, but most importantly, as I say, when you're choosing your program, the most important thing is to make sure that it is accredited. All right, make sure it is accredited, because you don't want to be spending 2, 3 years, 4 years doing a program and it not make no sense. All right, you can't be working so hard and not doing your research and then ending up spending all of this money, and at the end of the day you waste it completely. All right, thank you so much, guys, for tuning in. All right, remember to double tap on the screen here. Okay, double tap on the screen. Do you guys have any questions for me? Please go ahead and put it in the comment section. All right, and then okay, thank you so much, Daniel, for tuning in. All right. And then the other thing is, so after your program, so depending on what program you're doing, I'm gonna start with my NP program. When I did it, there are certain things that you definitely have to do in terms of your clinicals. When it comes on to documentation, you have to document on the university's portal, like the patients that you see on a daily basis. So one thing I would advise for persons to do, and my university encouraged it, was for you to go ahead and print out, like, all the patients that you've seen during your clinical experience, or your rotation. So you do that. You do enter your patient's information and then you print it out. So that way, so for example, when you graduate and you can't get a job, or it's hard for you to get a job because everybody is saying, oh, you don't have enough experience, you don't have none. The only thing they see is, oh, you have 10 years as a registered nurse or whatever area you're in. and now you're finished, with your program, and they're saying, oh, we don't see any experience, we can't give you, we don't know what you treated, they don't know anything about that. At least that information that you print out, that you did each term for your practicum, at least you'll have that to say, okay, then, so some persons will be a little bit soft and be like, okay, then we'll take that into consideration, because, everybody is short, there's always going to be a shortage of everything. So what you can do is you just take it to them and say, okay, then this is what I did for my, my OB rotation, or this is what I did for my, my gynae rotation. This is what I did for my pediatric rotations. These are the patients that I see. So that way they can be like, okay, so you've treated a patient with, appendicitis, so that way they'll be able to probably ask you a few questions and just kind of just get some information, drag your memory a little bit, to see how much you remember in terms of the management. So that will kind of just help with, probably securing a job as well. It might not work out all the time, because when I printed mine, nobody had asked me for anything. I just go ahead and sell my nursing experience. I tell them, well, this is what I have, so I think I'm the best candidate right now. So you just have to go out there and sell yourself real good when you're looking for a job. Make sure that, you give as much information as you possibly can about your experience, after you graduate. So that way, at least somebody can sit down and say, okay, I'll take a risk with you. Just go out there and shine, so that person can actually take a risk with you and give you that job. And once you get the opportunity, now it's time for you to, lift up, go out there and be the best version of whoever you are, the nurse you are, the doctor you are, the teacher you are, when you get there. All right. So just make sure you're doing that. All right. Thank you so much for tuning in. If you're new here, brown skin, hi, how are you doing? Brown skin says, how long are the prerequisites good for in Florida, and do I get credit for being a PCT? So honestly, brown skin, I am not so sure. I would say go ahead and check that out on the nursing board for Florida. All right. I never studied here in the US, my bachelor's. All right. I did my bachelor's in Jamaica. So I don't really know much about like the prerequisites and everything in the different states here, unfortunately. All right. Miss Portia G, thank you so much. Mrs. Portia G, thank you so much for tuning in. You're welcome. Okay, thank you so much for saying that. You don't have to study yourself real good. You will benefit from iron practices. Okay. Okay. Well, when I say sell yourself in terms of, putting your information out there so persons can know exactly what you're about. Okay, please show about my name is Nikhil. Nikhil, thank you so much for tuning in. All right. And thank you so much, Jason and Kev, for tuning in as well. Thank you for sharing. All right. So basically that's it with that part of, when you're getting into a program. There is this website after you finish, and this is for like nurse practitioners. Thank you so much, Jason. There is a website that you can go on and upload all of your information, and this is for the nurses. You upload all your information, including your certifications, your DEA, NPI, all of those information. And once you do that, what was that? I think I put a video up on that as well. It's called CAQH. That's the website. You go ahead and sign up on that website. You upload all of your information on that website. And so for example, you go out to do an application for a job, a lot of times, sometimes we might find out that we do applications and companies don't reach out to you, because that website, if persons already uploaded their information, that's the first place employers are going to go to get information about you, and they can decide whether or not you're somebody that they're going to be working with or they're going to be hiring from just viewing your credentials from there. So if they realize that you already have your NPI, if you have a DEA, if you have your malpractice insurance, the required certifications to work, if they say they want you to start tomorrow or the next, you know, then based on the information that you upload on that website, it's ready. They will just decide to go with you rather than with somebody else who has no information ready. So if you're a nurse here, just go ahead and look up that information, save it, do a bookmark or something. So that way, you know, by the time you finish your program, you can always go ahead and start uploading your information there. All right, Jason Love says you're welcome. Thank you for allowing me into your session. No problem, Jason Love. This is um open for everyone. Just go ahead and share it on your channel or on your WhatsApp so other persons can see the information and check in as well. All right. Hi, Slayer Phil. Welcome, welcome, welcome. All right. Jason Love says, well, like a stone, I'm rolling on G. Continue to grow, shine, elevating, and getting your blessing. Thank you so much. And same to you. Same to you. Thank you so much, Riley, for tuning in. Thank you. How are you guys doing? Remember to double tap the screen as you go along. Thank you so much, Slayer Fail, for saying that. All right. Where are you guys from? Yeah, you can just go ahead and put where you're from on in the comment section here when you get a chance. Do you guys have any questions that you want to ask? I know you guys are passing through. A lot of you are passing through, and I do appreciate you taking the time out. Have you guys had dinner already? I know it's probably late. What time is it? Oh my word. It is 7:30. Have you guys had dinner? Yeah, so I had dinner already. It's after 7. I'm gonna end the live. What city am I holding down? I am in the Dallas-Fort Worth area in Texas. All right. That's where I'm holding down for now. Where are you from, Jason? Have you been to Texas here? If you're not. All right. I remember I share a lot of videos, you know. Just go ahead and check out some of the videos on the channel when you guys get a chance, okay? And I also have this oh, it's after 4 in Los Angeles. Okay, okay. How is are you being affected by the fire right now, Jason? Yeah, I realize that there's a lot of persons, you know, with that fire out there. It's awful. It's awful, awful. Just make sure you guys are wearing masks and, you know, trying to make sure you're not inhaling too much of that smoke if you're exposed to it down that side. But yeah, so I am gonna run. I'm gonna try to ride a bicycle for a minute or two. I know I did say that, you know, this year is supposed to be the year where we're gonna be going into the gym for persons who have, you know, they didn't meet their 2024 resolution when I talk about going into the gym. And I said that, you know, we turn this thing into working out from home, and some of us are not that motivated to do that. And so, but either way, yeah, I'm gonna be going to ride my bicycle shortly and start from there. You know, small steps, baby steps. So yes, you've been to Houston. Okay, no, you're not affected. It seems to be only affecting the super rich. Oh Lord. Uh-oh. Well, My prayers go out for those rich folks down there and the poor ones too, because I'm sure persons are still, you still have some homeless folks down that side, hanging out amongst the rich. So I know they're being affected, with everything that's going on. So we just have to remember them in our prayers as we go along. Scott says healthcare seasonal this year. Healthcare seasonal this year. Okay. Hi, Zeta. Welcome, welcome, welcome. All right. So we just have to make sure we're sending up a prayer for those people down there. All right. Exercise. Yeah, I'm gonna exercise. I'm gonna ride my bicycle. Like yesterday, I was riding my bicycle. The day before, I was riding my bicycle. I get up in the morning, was riding my bicycle. So guess what? Yeah, even if it means 30 minutes, even if it means 30 minutes, I'm gonna be doing it until I'm able to do like the full 1 hour class. Jason Love says that's right. Start with where you're at. I'm not discriminating, love. Okay, no, I don't think so. No, just speaking the truth. Yeah, most of the time, the wildfire starts up that side, so that's fine. All right, so that's what I'm gonna be doing. I'm trying to see if I can drop what I want to drop 20 pounds. 20 pounds for the summer. So I want you guys to cheer me on. All right. Cheer me on as I go along on this journey. It's very hard, especially when you haven't exercised for a while. It's very hard, restarting. Because I tell you, when I start riding for 5 minutes, you know, I feel like I'm short of breath. Yeah, man. So I need to kind of take baby steps and go. Um, So Jason Love says those frames are custom fit just for you. You're wearing them right. Thank you. No. So I got these at Lens Crafters. Yeah. So there are most of my glasses are their sunglasses that I have them put my prescriptions in. So, and then it transitions. So, so that way I don't have to be switching out between. And I love them. When the thing with Lens Crafters though, like I love their glasses because I don't have to do much. Once I get my glasses, I don't have to do any adjustments or anything. Nothing not squeezing me around the side. It just sits on my face perfectly fine. So I just always work with them. I wouldn't switch them for anybody else, honestly. Their glasses just work out fine for me. I don't need to do anything with it. All right. Hi, Amza. Welcome, welcome, welcome. How are you doing? What's the time in India? Sudarsan, welcome to the channel. Jason Love says you can do it. Kind of change your diet. I know I have to be changing my diet. I have to be changing my diet this year because, last year was a little bit rough. So, and when we say rough, it means hard. So, I'm going to be changing my diet. I started out with the green juice. When I tell you, sometimes the green juice don't really taste so good. It don't taste good at all. Because I just blended some and it really had no taste. It just kind of bittery. And I never really like it. So I ended up putting some sugar in there. I'm not supposed to be putting no sugar in there because it's supposed to be like, just natural. But my word, can't do that to myself. Cannot do it to myself. So I put a little sugar in there. So hopefully I'll be able to drink it, between now and next week. Why Scott laughing? Yeah, man, this green juice thing. The other day I did one, but I put orange. I put orange. What else I put in it? I put celery. I put apples, with a whole heap of apple. So it tastes sweet. So this time I think that it was gonna be, it didn't have no taste. It didn't have no taste. It was just like so green. It was just so grassy. Yeah, man, that's what I have to do. It's like me throw it in my mouth and then I have to be like, holding my head back a little. So that way it doesn't really, disturb my taste bud them that much. Yeah, man, may I take it like a pill. Let me say, So I had to put a little sugar in there. And then, yeah, it was more like, when I give you the bittery, what they call it something there again when we used to be younger in Jamaica. They used to give you this thing to deworm you. Yeah, man, and you just take it and put it at the back of your throat and then swallow, make one gulp. That's what I was trying to do, but I had to put a little sugar in there to kind of make it taste a little bit better. So yeah. Thank you, Rajiv. Thank you so much for tuning in. Whatever you're eating and doing, it's right. Your skin is beautiful. Thank you so much. Thank you so much. I really don't do anything extra, except, if you hear my accent, I'm from Jamaica, so I still eat Jamaican food. So I don't know if that is what, yeah, man. I don't know if that is what is contributing to the glow that you guys are seeing. But that's about it. But thank you. I try not to eat a lot of fast food. I try not to eat a lot of fast food. So that's another plus, when it comes on to my diet. But I don't really eat anything out of the norm. Yeah. I don't really eat a lot of like fast food or anything like that. Rajiv says, where are you from? I'm from Jamaica. I'm from Jamaica. Yeah, but I'm in the States right now. So, yeah. Scott says she glow a lot. Yes, Scott, I am glowing. All right, your smile and personality speaks for itself. Thank you so much, Jason. Thank you. Yeah, so that's about it. But I definitely don't eat anything. First of all, I don't do caffeine. Yeah, a lot of persons will tend to ask me, how do I do night shift and don't drink caffeine or anything with caffeine? Yeah, I don't do caffeine. I don't do pork. I don't do bacon. I don't do shrimp. I don't do anything like that. I'll eat my regular parrot fish. And if you know, well, you're not supposed to eat parrot fish because, yeah, then produce the sand. Something like that. So, but when we go to Jamaica, parrot fish is there and I'll have parrot fish. And I love my snapper. Yeah, so those are the only two type of fish and goldfish I eat. And what else? I eat from the sea. Yeah, man, I don't really eat anything else from the sea. So all of those fancy stuff. When I was in Maine, they had like lobster, and everybody was like, "Oh my word, you're gonna eat a lot of." I said, "Me, no, sir. I don't eat those things. I don't do caffeine, the bacon." Yeah, when I moved here, I realized that bacon is a part of everything. You order egg, bacon come with it. So that was like a big throw off. And then the other day, I went and ordered a Whataburger sandwich, and it was night. Hi, hello, welcome everyone. Thank you so much for tuning in. Double tap on the screen while you're here, and if you're gonna be hopping off, remember to subscribe as well. All right. The other day I went and tried to buy a Whataburger because I was doing a night shift in this far road place. It was like 4 hours drive. So I was coming off the night and I decided that, I'm very hungry because I was working the entire day and I wanted to just eat late in the evening when I was heading back home. And I don't know who tell me to go ahead and order that Whataburger, but I ordered a chicken sandwich. And when I was in this dark car driving up, I took out my Whataburger sandwich to kind of um, start eating. Thank you so much, Jason, for tuning in. Adapt, I'm from Jamaica. All right. So I take out my Whataburger sandwich to start eating. And when I take out the sandwich, I could just smell this thing. But I wasn't really even paying any attention to it because in the car dark, I mean, I drive. So, when you're hungry, you drive and, you take out your sandwich and you start there, you know, you start eating. And when I look, I could only smell something, but I never really like it. And no, I never like it. And so when I look at it, I bite something and I realize that it was more of something hard I bite into. And I wasn't so sure what was that. You understand? So anyways, I kind of spit it out and pull over to the side of the road, turn on the light in the car. And when I look, is this stiff piece of bacon in my sandwich, me biting into. So, my entire, like everything just turned because it tastes bad, it smells bad. No disrespect to anybody who eat bacon on here, but I couldn't really understand. I couldn't understand what this thing was all about in terms of like everybody eating bacon, So it was just like this stiff piece of something there. So I just take the sandwich and just literally throw it out. You understand? Because when I said no, so I can't stomach this anymore. It's like I wanted to throw up because it was just smelling so bad. Me don't know if I rotten or it never cooked properly. I don't know, but it never really have a good scent. But I just end up on a straight, like literally just ditch it because, and then, the Monday morning, because that was the weekend, like I work only 3 days that week. So the Monday morning, when I was heading back down there, I stopped there and I tell them, look, this is my receipt, but for some strange reason, you guys gave me bacon. I need back my money. So, I ended up getting back my money, but I tell you, never again, never again. They put pork in everything. Yeah, they put pork in everything, and you just have to be careful. So when I go to places, I have to be like, I need a chicken sandwich, no bacon, no pork. And if it's a place where I've gone to before and I get, half ripe tomato, I have to say, I need ripe tomato. Yeah, man. I don't want the confusion. I don't want the confusion because, as I say, they put bacon in every single thing. I remember at one point I bought a bacon. Not a bacon, I bought a baked bean. And when I cut the baked bean and I look, I see one little piece of something. I say, when since baked bean come with these things, all to find out baked bean and bacon in the tin. So you have to really look to see exactly, what is in the food that you're buying. Because if you're not a bacon person, for some strange reason, you probably just see baked bean, and then by the time you look, you start cooking it, a strips of bacon that in the food. You understand? So you just have to be careful and look and read. So when I go in the supermarket, I just stick to the same one thing, and that's what I keep on telling people. If I know something and I'm good with it, I just work with it throughout. My hair product is the same thing. I've been using the same thing for how much years now? My body lotion, all of those things, like nothing no change, because if I'm fine with it, why do I need to change it? So when I come up here, if I find a bacon that is vegetarian, it's the same thing I'm eating throughout, because I don't want, don't want to confuse myself and go eat anything else I'm not supposed to eat, because may I tell you, that wasn't a good experience. But yeah, kudos to the folks who are enjoying their bacon. I always see people, doing bacon on their channels and all. So, but that was it regarding that bacon story. All right. Well, it is 7:30. I want to say thank you so much. I know. Waka Chaka, I'm loving your channel. Thank you so much for tuning in. Really appreciate you taking the time out. Yes, Scott, you will see me over there on that channel, the Mix Up channel. What time is it? It is 7:40. Yeah, so I am okay, you're in Alabama, USA. Okay, nice, nice. I passed through Alabama once when I was driving from Maine to Texas. That was a long trip, and I did enjoy it. I did enjoy it. What time is the live again, Scott? Is it 9 o'clock or hold on there? Let me see. Yes, so people, if you're here, and you're interested in, other channels, there's a channel called at Mix Up Boss. You can check out that channel as well. It's you have a lot of nurses over there and grown adults. All right, you have a lot of grown adults over there, and they have discussions about a lot of things, and there's so much information you'll get when it comes down to like relationships and all. Persons talk about different relationships that they've been in, and the outcome with some of them. So you can always go ahead and check out that channel when you get a chance. All right, but yeah, I'm gonna run now, and I will see you guys in another live. Remember to go ahead and give the video a thumbs up and check out the other content on my channel. I really appreciate you taking the time out to sneak over, really do appreciate that. But this is gonna be the end of the live for today until another time. All right, so enjoy your evening, and I will see you in the next video and the next live. All right, and remember to like and share the channel. All right, thank you so much, Scott, for reminding. All right. Enjoy your evening now, folks.